This little guy woke up, so had to continue going on with him. And he's going to be joining us. Hello, my name is Jeremy. I'm a paramedic and current nursing student, and welcome to The Real Truth. Like, comment, and subscribe, and hit the notification bell for future videos. And let's get started. I've been getting comments and emails about the comparisons of having a paramedic perspective and now seeing how I'm closer to my program, the nursing perspective. And believe it or not, there's a lot of similarities. So let's start with that. For one, they all have to work on orders. Now, my paramedic brothers are basically going to be like, that's certified BS. But is it really? For my colleagues, let's think about this for our standing protocols where we get the freedom to basically do what we want to do, right? Believe it or not, those are doctor's orders that's preset. I'll give you an example for my paramedic brothers. Overdosed heroin addict. You get the history from like a bystander. They pretty much said that they had too much oxycodone or codeine or heroin, just to make life a little bit easier, for the protocol. All right, so for us, it's too easy. We pretty much get a line, get the Narcan ready, 0.4 milligrams, and we get the medication, whether it's going to be IV or intranasal. Right there is pretty much a standing order, which is a doctor's order that you're working under the license. You just subconsciously did what a lot of nurses pretty much do, and then add the order and then notify the physician later. Granted, in a hospital setting, they would call a code rescue. The physician would come over and they basically will do it. But that's pretty much the game protocol. But they're not going to be mad if you pretty much have it ready for the physician to push it. And I know my paramedic brothers and sisters, they're going to basically be like, well, that's bullshit. Why I got to basically wait? Well, we're not in a hospital. Resources are not available for us, but it's available for them. So if we have the resources, why not use them? See, the way nursing is set up, you're able to improvise. You're able to basically do different things. Yes, you need a doctor's note, but it's more for like a prevention to make sure nothing goes wrong. In a sense, the same thing is done with medics when you radio in, when you're about to go inside the ER to transfer care. I would say the difference in this case would just be we handle the patient for a shorter time span and they handle it for a longer period of time with support. But the same could be said about the ICU nurse. They're handling pumps, balloon pumps, they're infusions, they're handling multiple drips, they're handling blood transfusions. And my fellow paramedics are like, hey, we do the same thing. And yeah, I understand like there was like a study in like Texas, and I believe in the CCT aspect that they do prep blood transfusions also. But we all essentially do pretty similar work. You might be saying, well, medics have the freedom to intubate. And that's true. But that's a necessity. We're the highest trained professionals that arrive on the scene, and if a person's down in less than 8 intubate, that's just the way it is. Essentially, nurses don't really need that because they have the respiratory therapists, they have the physicians there, they have the PAs. They can all really intubate, so they don't necessarily have to do it, but they can get the medications ready for like the sucks or whatever to basically make the paralytic happen in case they have to. This little guy woke up, so had to continue going on with him. And he's going to be joining us. So from a nurse's point of view, they have to deal with a lot of medications. And coming from a paramedic's point of view, it's usually if there is a nurse trained in the ER setting. If they're not, it's a little different. If they're not trained in the ER ICU setting, they pretty much get a brief of the complete heart blocks and really specialize in. This is probably the reason why every single medic known to man that's either worked in a hospital, that's had conversation with a nurse, really notices that nurses really hate cardiology. Us as paramedics, that's the bulk of our job. We have the life pack, we know how to synchronize cardiovert, we know how to pace, we know how to basically shock, we know how to essentially run a code by ourselves if we necessarily needed to. Essentially, in the emergency setting, that's kind of the difference between us, but the difference is kind of different. If it's not, oh, he's yawning. Okay, hold on. The difference is, out in the field, we're going to call the shots. With them, the nurse may, because like after they graduate and they train in the ER setting, they know a good amount. You can't underestimate. But outside of the emergency aspect, the nurse has a more complete, rounded knowledge when it comes to healthcare than a paramedic. From the nurse's end, we know the lab values, the ABGs, red blood cell counts, the importance of neutrophils. We know the importance of the infections, and we know the importance of different various medications that is going to be required for long-term stay in a mission. And at the end of the day, ultimately, that's the difference. Paramedics, we focus on short term and keeping them alive and then dropping them off to the nurse. The nurse focuses on maintaining them after the physician gets their assessment and keeping them alive and keeping the pumps and everything going. But at the end of the day, you need both in order for patients that's unresponsive to basically succeed and to basically like survive. So we're all one big happy family. It's just the nurses are usually more grumpier. I'll just put it like that. If you're still here at the end of this video, go ahead and hit the like, comment, and subscribe, and go ahead and look at future videos right over here. And it might be more useful information for if you're going towards the nursing end or you're even considering the paramedic end. Like, comment, and subscribe, and see you in the next video. Later.